Mario, can you please step forward and show us the 5 different types of lymphatic drainage you learned? They have worked together now for 2 months. Does it hurt you when I massage this point? It hurts just a little bit. I do the drainage for her every day at home for almost an hour.
Mezz'ora, 3/4 d'ora, soprattutto perché la Carla ha un caso un po' particolare, nel senso che ha dei grossi problemi di salute, quindi ha un braccio molto compromesso.
Friend Carla, can you turn around now, please, so that Mario can show us the other oriental lymphatic drainage points? There's a spot on the upper legs to drain, and one on the buttocks. Mario, can you show us now the one on the shoulder? Now, while you're seeing Mario demonstrate a few points, there are many, many in the body. These are just enough to help the body clean out and get better.
Appoggio in questo modo e lei qui ha molto male. Appoggio così e faccio questo sistema che secondo Paul, penso senz'altro, aiuta a scaricare molto il sistema linfatico. Bene. Sì, non fa male praticamente. E faccio questo sistema di massaggio che scarica completamente.
Non si vede tanto.
Non c'è molto da vedere.
E a questo punto.
If we'd like to understand the concept of lymphatic drainage points, we start from the understanding that they should never be filled. And when they are filled, we'd better open them up so that the body can use its own recuperative mechanisms to do the work necessary to move the poisons. I worked with maybe tens and tens of different groups when I started and was able to narrow down the points that are more efficient.
Perché nel progetto Genesi, che è un libricino e dei DVD, dei programmi televisivi.
Ladies and gentlemen, what you are about to hear is of historical importance. On the internet, you can find out everything about Project Genesis. There's a booklet, you can watch videos and television programs, and it's all for free. There are also 50 testimonials, but very few are as impressive as the one friend Carla is about to share with you. So, friend Carla, take a deep breath, look into the video camera, and tell us your story. I have a very serious health problem. I have an incurable cancer, and no one has been able to find the cause. I have undergone a partial mastectomy. I have had chemotherapy and radiation therapy. It seemed that the cancer was gone. After 3 years, I had what they called a relapse, a metastasis, and again, no one understood the cause. They had to operate a second time. My problems increased. I began losing the sensitivity in my right arm. My left arm swelled to twice its normal size. I suffered inflammation in my whole body, and I put on weight. I lost the ability to use my left arm freely. I underwent further exams and checkups regularly. Specialists in Torino prescribed various diets, but sadly, I didn't achieve the results that I desired. The clinical exams were good, while the blood exams were bad. At this point, the doctors told me not to be afraid. They would do some more specific exams to understand how the situation would evolve.
Con dei controlli sistematici, pur già avendo adottato un sistema nutrizionale idoneo, frequentando dei medici a Torino, ovviamente non ho raggiunto gli esiti sperati, anche perché ho avuto un problema che mentre avevo degli esami clinici buoni, avevo degli esami del sangue non buoni. A questo punto
My friends told me about Paul. At that point, I decided to go see him and get to know him better. I listened with great attention to all the suggestions and indications he gave me. You can look them all up in his booklet. They seem easy to follow, but it takes a lot of determination to really follow correctly. Therefore, it is important to understand the work to be done before you start. I have to say that Paul's attitude towards his patients is extraordinary. Whenever you have a problem or you feel down or less motivated, he is always available and willing to help, in person or on the phone. He will be disappointed and correct you when you don't ask for the help you need as soon as you need it. Many doctors don't want you to call them. They make you feel that you don't have the right to call them. Paul doesn't work like that. I followed all his suggestions because that is how he works. He doesn't obligate you to do anything, but when you show determination and don't look for excuses to avoid the hard work that has to be done, he will do anything to help you achieve your goal. Thanks to his complete support, I adopted all his suggestions. It's hard in the beginning because it's necessary to completely change your mentality about nutrition. You also have to work seriously with the weights, the ice, and do the oriental lymphatic drainage. After a while, it gets easier. It starts to become a new way of living, especially after getting your first results.
E continuamente tutti I giorni dovevo adattarmi a delle pillole, a tante cose per poter evacuare, perché capivo che questo era per me un dramma.
As I said before, I had suffered from constipation from birth, and I always had to take pills to go to the bathroom. You can understand that this was a big stress every day. Since I got ill, I suffered also from insomnia and therefore had to take drops every evening to be able to sleep a few hours. Thanks to our work together, I don't suffer from constipation or insomnia anymore. I still have some problems with the lymphatic system in my left arm due to the surgical trauma. My weight returned to normal. There are moments that I feel very well, and there are moments that I don't as the toxins leave my tissues and move through my bloodstream to the kidneys.
Io non ho più preso pillole per la STIPS né gocce per dormire. Oltretutto dal sistema linfatico non ho risolto.
I will continue to take care of my body as I am doing now, hoping, no, convinced to continue getting better.
Dei momenti che va meno meglio, ma continuerò questo percorso di modo, cioè proprio nella speranza, anzi nella convinzione di riuscire a trovare.
Thank you very much for telling us so many difficult and private parts of your life. Friend Carla wasn't sure that she would be able to communicate her own story clearly in a room full of strangers in front of a video camera, but I think she did a uniquely special and courageous job. Thank you very much.
Adesso consideriamo un paio di cose insieme.